Dobrý den, vítejte u další epizody podcastu Efektivní zdravotnictví, který připravuje iniciativa pro efektivní zdravotnictví. Mé jméno je Marek Navrátil. Dnes tu budu mít speciálního hosta, jejím šéfka Světové zdravotnické organizace Zsofii Pusztai. Ještě předtím, než ji představím, tak bych vás rád upozornil na výstupy, které připravujeme v rámci iniciativy pro efektivní zdravotnictví, které můžete sledovat na stránkách efektivnizdravotnictví.cz. Můžete se přihlásit k odběru našeho pravidelného newsletteru, odebírat naše články a výstupy a taky na stránkách najdete způsoby, jak podpořit naši činnost. A teď již přepnu do anglického jazyka, protože dnešní rozhovor bude tedy v angličtině s českými titulky pro ty z vás, kdo angličtinou nevládnou. So, as I said, my guest today is Zsofii Pusztai. Did I say that right? Yeah. Sorry for the earlier mispronunciation. Zsofia is the WHO representative and head of the WHO's Czech country office. So thank you for accepting the invitation to join the podcast.
Thank you so much, and dobrý den. I understand a little Czech, but unfortunately I don't speak yet, so we're going to continue in English.
Yes, no problem. I think most of our listeners will be familiar with the English language, and we will provide subtitles for those who don't. So, but it's good to have some of the Czech basics already. How long have you been in the Czech Republic?
It's been my second year.
Second year. It actually, I always ask the guests first question just to describe their professional background and what kind of led them to where they are today. So, can you tell our viewers and listeners a little bit about your journey?
Yes, thank you so much for that. And honestly, I was grown up in this region, so that's already. Originally, I'm from Budapest, but I worked for WHO for 20 years. But I was grown up in a teacher's family, in an educator's family, in a very open house. My dad was a scientist, my mom was a teacher. We always kept an open house, especially for the vulnerable, and somehow either students or scientists or academicians. So we kind of grown up with my sister into really focusing on the ones who left behind. And that led me also to medical studies, also partly due to the fact that I was sick between the age of 6 and 10. So I spent most of my time in hospitals. And I read a lot of books. One of them was Albert Schweitzer. I don't know if you ever heard of that. He was a Swiss missionary, really supporting in African region. Somehow his mission, early 20th century, became like a great example for me. And even though I'm a pediatrician myself, and I worked as an intensive care pediatrician because I'm kind of action-oriented, and I really liked to see immediate impact of what I was doing. But I always, because I had a second university degree, also in international policies, but also related to economics. And somehow I became interested, what you can do beyond as working as a doctor, what you can do for population. And when the opportunity came to apply the position, I did, and I succeeded, even though at that time when I got the job, I was already expecting my first child. So I was a bit hesitant to immediately start to work for WHO. But WHO also been very supportive for having, work-life balance and having family. So that's how my career started over 20 years ago. I started in my own home country, but then I also moved for the Balkan region. And then I had a little intermezzo as well, which I think it was also good to go back during the COVID to my original roots, also working in the field again and also building up a health promotion program. But of course, they kept coming back to me to ask to return because my heart's always been with WHO. I'm very passionate about its mission. And that's how I ended up in Prague and in your beautiful country to continue working with WHO for the better health of people in every country where we work for. Mm-hmm. So that's my short background on that.
Mm-hmm. Yes, I noticed when doing a preparation for this interview that you also worked in Serbia. So I wonder how was the transition for you, or like any meaningful differences that you saw switching from Belgrade in Serbia to Prague?
Oh, that's completely different. Of course, every country and every region is different. And, WHO works in 6 regions. And our European region is the most diverse one because we have 53 countries from practically Iceland to Tajikistan, but it also includes Israel. So we are a very diverse, very complicated region. And of course, when it comes to Serbia, and I also was responsible for Kosovo and partly for the Balkans. I mean, Western Balkans is also a challenging place, even though, for instance, when it comes to public health, they had a very strong institution of public health education for almost like 100 years. So there's been pros and cons, but it's always exciting to work in other countries. And of course, in Serbia, you have a huge UN presence. Because, in those countries, especially after the war in the 90s, there was big UN presence established there. And there is a very strong collaboration with multilateral partners that also helps to progress the agenda, including health as well.
Mm-hmm, mm-hmm. Yeah, the reason I asked about the differences is that since WHO is a global entity, I realize it comes, as you said, it comes with different challenges in each country where WHO operates. And that also leads me to the question, if you can describe the overall role of the WHO and what are the kind of strategic directions in which the WHO is trying to push the world in a way.
WHO has like 149 member states. So, of course, we have our governing bodies, we have our executive board, and also we have the regional committees. So we work in 6 regions, but we also have our headquarters and we have the country offices. And as I said, our region is one of the most diverse and most complex ones. But it doesn't mean, there are differences. On the other hand, what COVID and recent perma-crisis and all this speed of change that we are living today, it really was a wake-up call for many countries that the only way to move forward is really to work together, especially when it comes to global health. Because we also see what is the impact if we do not do it, because it had serious impact on economy, it also on the well-being. So it's very important to keep this multilateral cooperation. WHO itself is also ongoing in a transformative process based on member states' requests, because we are a specialized technical agency. Our key focus is really health and how we can support health for having the highest attain possible of good health and well-being for every individual in every country. But what came through this transformation, it was really to move our capacities to the countries so we can work closer with each other, and that can also enhance this multilateral cooperation. And even in EU countries like Greece, countries like Cyprus, even now Portugal, they are also opening up country offices, especially that can enhance a joint collaboration, share practices, and we only see the benefits of it, and all other countries see it. So I think it's getting more and more important to really work in a more unified way that can help to really build back resilient and sustainable health system that was really seriously interrupted during the COVID pandemic.
Mm-hmm, mm-hmm. And maybe just to come back to, if you could zoom out to the WHO as a global entity, how do you see the role of the WHO on a global level?
As I said, we also see a lot of, we call it mega trends, because as I said, we live in a perma-crisis, but what we see also, there's been substantial challenges put on health system globally and in every country. No country could be left out. First there is aging population, especially in Europe and especially, by the way, in Czech Republic, rapidly aging population. So there are demographic changes. There's also the climate change. The direct and indirect impact of climate change are enormous, and we already see its impact. Then, of course, we had all these emergencies, let it be COVID, in our region, war as well. Increasing inequalities, that really put a huge burden also on the health system, and we really have to focus much more on the social gradient and how to address the needs of the most vulnerable population. So the challenges are really common when it comes to that, and that is why WHO, through its governing bodies, which means that, regularly they meet with all the member states, we jointly drive together the agenda, and we have a general program of work. We call it GPW 14, but it's the General Program of Work 14 that was adopted by all countries, these 194 countries, just last May. And we also have in our region, similar, we call it European Program of Work. We also call it United Action for Better Health. And we focus on key strategic priority areas that was asked by the countries, by the member states. And we call it 3 Ps. Is like provide, protect, and promote. So when we talk about provide, is really providing access to good quality healthcare services for everyone, and that includes not only focus on how to move care for primary healthcare, how to focus more on healthcare workforce, sustainable strategies, how to focus on public health, how to focus on increasing needs of mental health, on pharmaceutical policies. So that's from the health system perspective. That's the first P. The second P is protect, and it's really protect, prepare, detect, and respond for any type of health emergencies. And we have a lot of lessons learned from COVID, but there's still an ongoing process how we can prepare our countries better for any future possible health emergencies. The third P is promote, and it's really putting a focus. Every country struggles with non-communicable diseases, behavioral risk factors, preventable diseases, chronic diseases, but also, adaptation and mitigation to climate change. So that's the third package really on health promotion and private prevention. And as a cornerstone of all these 3 is the good health information system. Data, not only data, but, how you use those data for evidence-informed policy makings. How is the digitalization is going? How you harness innovation? How you use the AI technology? I mean, there are so many emerging questions that every country is struggling. So these are the 4 priority areas that now, in agreement with all of our countries, we are going to focus on.
Mm-hmm. Great. It sounds very comprehensive, and I think these are very ambitious. Maybe to bring it to like the specific level of the Czech population, because for many people this will be still very abstract. So if you can talk about it from the perspective of the Czech country office, what are maybe some of the specific projects that you're working on in those maybe priority areas, in those provide, protect, promote, or with data? Like how can we actually picture the work that the WHO is doing on the ground in this country?
And thank you for the question, because I think that would have been my next, continue the discussion we started. We also, as I said, we going through a transformation as WHO. And part of that, not only, the strengthening our country presence in a way that we bring technical capacities closer to the countries, but also we're moving from the regular biannual collaborative agreement that we used to have, because WHO exists in this country for 30 years. Over 30 years, but it's been always like biannual operational action plan. But now this year we call it a country cooperation strategy with the Ministry of Health, who is our key partners, and we signed a 6-year more long-term strategic document aligned to these priorities that is tailored to the Czech health system needs. So we've been working together on that for a couple of months to finalize and develop it, and it gives a clear structure that aligns to your National Health 2030 plan, but also to the SDGs 2030. So everything has the target 2030. And then when we come to the first one, as I said, the first strategic priority areas, I can give you like tangible examples. The first that is important, we started to work together because the Ministry of Health and the government would like to move ahead with the healthcare workforce strategy, because clearly that's an issue that links to many areas, and to be able to establish a planning and forecasting unit, but also to see where you are. We're going to have a kind of joint mapping and review, what is the current legislation, the framework, what to collect the relevant data, and then you can do a proper mapping, and then you can start a discussion, and lead to that. We usually support policy dialogue. So you get all the different stakeholders around one table, and based on these review findings, you can then start the discussion, because of course, every stakeholder might have different interests and view, and it's very important that everyone understands and they are on the same table and discuss what is the future of a healthcare workforce strategy. That not only links, on the hospital and primary healthcare side, but that also links to the public health side. And that's the other work stream in that strategic priority areas is really the public health, because the country itself is going on a public health reform. I think one of the lessons learned also from COVID was that there are issues that needs to be addressed, and we very much work closely together to support that public health reform. Not only, what what system should look like and what functions the system will have, but also how you can modernize the public health education. What are the core competencies that in the 21st century a public health expert needs to have? So we aligned, and it's already been the third time this year, that we grabbed all the main universities, all the key institutes, including UZIS, the National Institute of Public Health, but also Ministry of Health and Education, to come together and start discussing. And we are in the process of establishing a working group to really mapping and assessing what are the needs. There are, of course, good practices, but I mean, the needs are different. And you really would like to attract young, dedicated professionals, not only medical doctors. You really need to attract for different professionals to raise the next generation of public health experts in the country. So that's also a working stream that we are doing right now. But also if it comes, for instance, the mental health, there is clearly every country. And it started even before COVID, but I think COVID and the recent crisis show clearly that the mental health needs is huge in every country. So the country, Czech Republic, already started a huge mental health reform in the previous decade, which really deinstitutionalized the care. And I think it's a very good example what are the community-based mental health services is doing here. But clearly the Ukrainian refugee crisis and the COVID put an extra burden on the system. And we need to find a joint way and support each other. And we also have a working stream on sustainable mental health financing on the community-based mental health services, how to make it sustainable to align with the increased needs. So I could continue on this one, but let's go to the protect side, because that's the emergency preparedness. And that's we also working together with the Ministry of Health, and that goes beyond even the Ministry of Health, how to be better prepared for any new potential, either pandemic or any new emergencies. It can be even floods related, as we also seen this autumn. But it's important that we have the international health regulation that every country signs. It's kind of compulsory. That's one of the few legally binding documents that WHO has, because we are not the European Union. So we only provide recommendation, but that's legally binding. And under the international health regulation, and together with the EU and ECDC, there is a joint agreement that every country is going through now, a kind of joint review where the system are and how they can be better prepared. It's kind of broad exercise, so it takes a lot of preparation. Czech Republic is also with ECDC. There is a scheduled plan for that. And then in long term, because we're talking about like a 6-year country cooperation strategy, long term, the aim is after all this joint review and how to be better prepared, there are certain simulation exercises included, but it's more on system level, what needs to be done, how to update your pandemic preparedness plan, but also to end up a national health security plan. That would be the ideal target, because everything when it comes to emergency, that closely links to security as well. And I think national security is a key for every country now. And then, of course, when it comes to the third important strategic priority areas, I think I don't have to talk a lot about risky behavior in NCDs, but clearly this is something that every country struggles. Of course, when it comes to mortality and morbidity, all linked to that. And clearly there are issues also, especially in the Czech Republic, because there are some positive trends as well, we see, but there's also negative trends. When it comes to alcohol consumption, it's one of the highest in Europe. When it comes to obesity and overweight and dietary habits, there is an issue. So primary prevention and really invest much more in that area is also our joint efforts that we are working right now with the Ministry of Health and also National Institute of Public Health and also with the regions. Because just to give a good example as well, and then I will finish so you can ask the next question, but you also have great examples of various WHO-led networks, and one of them is actually the Healthy Cities Network. Actually, this is something like you work together with local governments, and the Czech network is one of the strongest in Europe. So you can be proud of that. And actually, the city of Brno is the one who is also leading several pilot projects. That is also kind of a good example for other countries as well. also how that can be linked to a well-being economy initiative, because as we discussed, has really a serious implication, how it links to economy and well-being of the population. So all in all, I think there are clear areas, and then we can have and continue discussions separately on the health information system as we go ahead with the interview, because that links to all of this that we are doing.
Yeah, definitely. I would like to still come back to some of those examples that you mentioned. I think they are great to illustrate what specifically you're focusing on. I'm also thinking when you list those challenges that are definitely very relevant for the Czech population, like we know that the rate of premature death from cardiovascular diseases and several types of cancers, for instance, are among the highest in Europe. So it's definitely important to focus on it. And I think there could be examples like from other countries on how to proactively prevent those non-communicable illnesses from occurring. I'm also wondering, just to maybe drill down on the practical impact of the WHO, how you can actually ensure that things are moving ahead. Because as you said, many of your your mandate isn't as strong in terms of you cannot enforce any of those recommendations that you might come up with. And so I'm wondering, what is the actual success in actually delivering the practical implications of those policies or strategies? Maybe focusing on the primary prevention or the risky behaviors.
One of them, coming back, for instance, very well tobacco legislation and tobacco control legislation, and it was also supported and initiated by WHO. So that's a very tangible, I think, results, not only in Czech Republic, I think in most of the countries to make it happen. Because you recall how it was before, that you went to any restaurants or pub or public spaces and then you could hardly breathe. And we all know the second-hand smoking implications and impact on health. And it was really WHO in most of the countries engaging not only with the Ministry of Health, but you needed to engage with the parliamentarians, you needed to engage with the key stakeholders, with Ministry of Trade unions, hospitality sector, media. So there's been a lot of debate, and many countries came a bit later. Some countries introduced it earlier, some countries introduced later. And it's not only the legislation on, that you cannot smoke in public spaces, but it's also the packaging and also access to tobacco products. So there have been a couple of measurements that you align also for the framework on tobacco convention. Mm-hmm. And the question is really how you also, of course, ensure that enforcement is in place. But that's one practical example. The same can be applied to any type of taxation or, restricting of marketing that we are working. There are a couple of working groups established either by the government, by the ministry, and then from our team, the relevant people are participating in it. And whenever there is an immediate need, because many times they need experience from other countries, even if it needs to be experience from 53 countries, who's been doing what and how, we call it like a rapid response team. So they come to us, and sometimes even in 24 hours, we prepare a complete and immediate, follow-up that they can really help them to prevent any substantial impact. And a good example I can also bring on breastfeeding, because right now, recently, we've also been working together on breastfeeding and, how to ensure also that the breast milk substitutes are not promoted for the young moms who would like to breastfeed, because the breastfeeding rate is kind of low in the Czech Republic. And there's been also discussion, how to interfere, and, when they need evidence immediately, then you bring it in 24 hours and then they can move ahead. And then there's either new legislation or new policy in place or a new action plan. And then you also can support piloting programs, because we're also discussing on certain areas to support piloting process. Then as we are a neutral player, we also do a lot of facilitation to bring the different stakeholders in one table, because what we observe, and it's not a Czech specificity, I think it's a bit more Central European specificity, that unfortunately intersectoral coordination, talking to each other, even though this is not a big country. None of the countries are that big in our region. Still talking to each other, sometimes it can be challenging. And we really see our role as convening power to bring partners together, start to talk, and then can accelerate actions to be done. So that's also either in a roundtable or a policy dialogue discussion. Then also there are certain areas where capacities can be further strengthened and built. Just recently, if you want to bring a concrete example, it's also been, we had a joint review with the Ministry of Health and national stakeholders on the health information system. And based on that, already we started to have targeted interventions. And one of them, we had 5 days joint capacity building on population health surveillance. It's usually for small targeted groups. If you want to make it efficient, it's usually 15 or 20. But it was a very hands-on exercise. And it was interesting to see that some of the participants, because we had participants from regions, from institutes, one of them who's been working for 22 years in the ministry, he said even she never thought that she can learn still something new, and there was still something very useful and how to take further. So I think these are also important, and we've done a couple of those. We've done those on risk communication, on community engagement, related to surveillance. So, but it always depends on the needs, because usually either the counterparts or the national institutes or Ministry of Health comes to ask if there is an opportunity for that. So that's also could be. And the third and final, I would say, that also what we see, and it's working very well here, that we also have a lot of public health leadership academy or pan-European network on NCDs, either summer schools or academies where we spend champions from the Czech Republic. Because there are also people who would like to go and see and discuss, and then they meet other countries and experts. These are very rich, and they come back so enthusiastically that they themselves can accelerate actions to be happen. And we also see example on that. And as a positive note, WHO in the past 4 years, and it's continuing to do, nominated 4 WHO collaborating centers. You have great center of excellence, great research capacities here, and WHO collaborating centers are the ones who are not working for the country itself, but to bring expertise, teaching, educating capacities, also research capacities to other countries in the region. And also, sharing good practices, exchanging. So these are really center of excellence, not only for Czech Republic, but for other countries as well. And Czech Republic's really been upscaling, and we're supporting a lot that. It's a 1-year designation process. It's very throughout, very deep, because it's very based on rigorous process. But we are happy to see that already 4 was nominated, and the 5th is on the way, on various areas, including mental health, including maternal and child health, including also from Bruno Retetox recently, also now on developing guidelines from NICES. So there is a lot of good plans and still more interest. So I think we would like to really bring up more and more Czech rich scientific expertise to Europe and to the world as well.
Yeah, I think there is a lot of expertise and high quality science centers in the country. It's mostly about making sure that they kind of work together and that we find those synergies in the system. And we also, I think, have a lot of potential for the public health experts. But to move on to another point that I really wanted to discuss would be the role of potential role of a strong public health institution in the Czech Republic, because we know that the Státní zdravotní ústav is full of great experts, full of potential for how it can play a role in the development of the Czech system. But we know that it's not very well financed, and there are talks about maybe reforming it to play a bigger role in the system. So have you been engaged in those discussions, and what do you think about the potential future role of the SZU or what might come afterwards?
I mean, that's one of really the key area that we are working together now. And it's clearly, as I said, COVID brought up to light some root causes and root problems. And there is a very fortunate situation right now in a way that when I arrived to the country and I first went to the Ministry of Health, I could see that in 22 years, there was 26 ministers in place. So I said, that's very difficult to start any big reform on that. And first, there is a bit stability, I think, compared to previous years, because now you have a minister who's been on board for a couple of years, which already allows a window of opportunity for more and substantial changes. And we see this is happening, and that is why we align our forces for this long-term plan. And one of them is really the public health reform. And we know that the government council was established on public health, that already kind of ensuring the multi-stakeholder engagement, but also how you can bring in the necessary evidence and science that can support to make that happen. That's why we also work together to also improve the capacity side and how to improve the public healthcare workforce and how to change the reform, because there's been a lot of fragmentation in the system. So there's a clear commitment, because you always need to have a political will and political commitment, and it is there right now. So within the country cooperation strategy, we also call it like a country support plan or country support package. And what I said before, the strategic priority areas we all agreed, is one of them is really the public health. So we're mobilizing a lot of support and expertise, and we have a daily, almost daily contact, not only the Minister of Public Health, but because the director of the Institute of Public Health, Dr. Bara Matskova, is also now the chief health scientist. I think it also gives an opportunity to align these two reforms. But of course, it requires investment as well. And one of the obstacles that we see here in the Czech Republic is the extreme low salary of the public sector. And honestly, for building back trust in science and in institutions, you need to have a strong public sector. Because nowadays, when we see all this AI technology, innovation, everything comes from private sector. But public sector also should have a very key role when it comes to that. But for that, you need to attract and retain good, talented people. And it's a very difficult situation right now if you cannot guarantee that is there. And I always admire. We work a lot with public sector, of course, because this is our main partner. And it's not that easy when there's such a huge gap between the private and public sector salary gap here. So, yes, we're also discussing how to came forward. But I think the first steps is really to start to see, how to avoid, how to get rid of the fragmentation, how to get a more unified system. What is the umbrella? Looks like, how to reform the public health system. That would have implications to better preparedness, that would have implications for better primary prevention. But then the question still remains how to enhance. And that's more a governmental decision to improve the salary of the public sector.
Yes, it's clear when you look at the numbers that the public health sector is getting only a fraction of the total health spending, which I think in international comparison is quite alarming here.
Yes.
But I'm wondering, if we do manage to make the stakeholders in the political arena dedicate more money to the public health, what are some recommendations on how to actually spend it well to meet some of those public health goals? Like I'm thinking specifically, like if we were to increase the budget of the SZU or another public health institution, like what could be some of the key roles that such an institution could have on top of what it's already doing, like to actually achieve those goals if we manage to get that additional funding?
It's not only on the Public Health Institute, but I think in general, what is and then we move to the fourth area I wanted to talk about is really there is, Czech Republic is a high-income EU country, and if you look at some of the data, clearly what you spend on health, like health spending, is compared to EU, you are not that bad. You also have a very generous benefit package. As you said, you have very low spending on prevention and public health, but there are also efficiency gains. And that's visible for the overused hospital system. Clearly, if you look at, the number of hospital beds, the use of hospital beds, also there are data and indications that there is efficiency gains. But for that, it's very important to have the data. Interoperability, but also to check the outcome outputs level, because you need to know clearly, what where you are, where are the inefficiencies, why there is increasing inequalities, how to also address those gaps. But also you need to know it because when you have various impact assessment and health system performance assessment, for instance, it would be a huge added value because it's ongoing right now with OECD support. The first report is planned to come out next year. It might be not next year, but 26. But still, they're working on that. And I think that would really make a substantial difference. Also, when it comes to digitalization, I mean, clearly that's one issue that the country has to move ahead. And there is also ongoing plans, but not only moving ahead, but to make it in a sustainable way. Because that's the only way. I mean, you can create a completely new public health system, but if you do not have that transparent and data analysis that you use for evidence-informed policy making, so if you do not link the science to policies, if you do not improve this knowledge management side, then it's very difficult to build up new policies and public health. So I think that's the key element to start with. And then you can make further plans. And of course, for a big public health reform, you can have also EU investment funds, but the EU investment funds, you need to have to already keep in mind that how you will make the system sustainable in longer run. And for that, you need better data and knowledge management.
Yeah, luckily there seems to be movement on the sharing of medical data and also on the access for scientists to access some of the registries by USIS. It's been great to see that it's opening up a little bit, and hopefully the efforts to also have shared electronic health records will be successful. But it still seems like there's a couple of years to go before we get there.
But at least it's there. And USIS is also WHO collaborating center, by the way. So there is absolutely visible progress and efforts. And I'm sorry if I didn't mention, but I think also the integration of health and social care. That would be also crucial. And there is also plans and reform on that. And there is already a progress on that, which is also critical.
Yeah. These are topics that we're focusing on in our initiative as well. We had previous podcast guests where we talked both about the integration of health and social systems. And in the last episode, we also talked about the efficiency of the hospitals. So we definitely consider these important as well. I also wanted to drill down a little bit on the health financing. Like when you look at the whole mix of the private and public investments in the Czech healthcare system, what is your assessment, maybe like looking at, again, some international benchmarks, any recommendations on how the mix can be improved to also improve health outcomes of the Czech population?
Yeah, when it comes also to health financing, first you have a great team in the Ministry of Health and we're working together and closely on that. And also you have to know that WHO in our region is supporting a country's law to do a financial protection studies. And in the Czech Republic, the new one, after many years, because of COVID it was interrupted, it's going to be published next year as well. So we're going to have more data. You still have a very generous benefit package. But on the other hand, time to time, co-payments pops up. And honestly, this is, and that is why it's important that we have also that financial protection studies coming out. Because the question is, as I said already, in general spending as a share of GDP, the country is really spending a lot. And public funding is one of the highest when it comes to health in Europe, in the Czech Republic. But if you introduce without any root cause analysis, any problem analysis, co-payments, that has a huge threat that it would exacerbate further inequalities. And we already know that, increasing inequities has an impact on economy, on well-being. So we really have to focus on the most vulnerable. And even Western countries are moving now to strengthening financial protection. So not weakening and strengthening. For instance, even Netherlands or even introduce subsidies for the poorer population. So I think before doing any actions, and again, I'm coming back to data, you need to have really the outcome and output data and to understand better what are the root problems and how to address the inefficiency gaps before introducing any potential co-payments into the system.
Mm-hmm. Yeah, there are definitely risks involved, and it seems like the public discussion is a bit simplified, and it sometimes doesn't take into account those potential, let's say, negative externalities or unintended consequences of such measures. But do you consider the lack of private funding in general, like, looking away maybe from the co-payment specifically, but can it be a threat to the Czech system that we don't have such a high share of private funding, or do you actually consider it as maybe an advantage even?
We consider it more as an advantage, honestly, because when we talk about universal health coverage, really your country is one of the, if you wanted to bring us good example, it would be one of them, that you really have a very generous benefit package. On the other hand, I agree that I think it's more the inefficiency again, the care should be moved more towards primary health care. And I think every health system, and that's also a lesson learned since COVID and war, and we also have our talent charter as WHO. It's been signed like 15 years ago, and just last year we have renewal of that. And really trust and transformation were the key two words in the system. First is really how to build back trust, not only in science, but also in state institutions. And I think it's really important to keep that in mind. And because you have that system in place, communication that is linked to trust, because there's so much misinformation. And I think it's very important to continue to communicate in a simple, pragmatic way also to the public, why these changes needs to be done. And it's their own interest, because that would also, to be honest, support the regional disparities. Because as you said, even if you look at the healthcare workforce, compared to EU average, the number of doctors and nurses are quite fine also here. The question is more, what are the regional disparities when it comes to that, and also the aging healthcare workforce. So it's more really the regional disparities that you have to go and dig in deeper. And then you can easily explain why the care needs to also move closer to the patient. And primary healthcare is really one critical element, because in the Czech Republic you have solo practices. And honestly, in long term, it will not be sustainable. So clearly there is a need to be changed, and we're also discussing it and working on that together.
Mm-hmm. Yes, definitely. It seems to be inevitable, but we also will see what the next political administrations will bring, because it's also uncertain whether the direction we're on right now will be the same. I think it also may reflect some global developments in terms of rise in populism and anti-institutional narratives that are circulating in the digital sphere, most of all. So I don't know. Do you see any changes in the way that the WHO will be working in the next years, given those trends?
To be honest, when we look at the megatrends, one of our really key focus, and it's going to continue, so is really to building back trust in science and to address this misinformation. And just this September, actually, we had a very nice roundtable here organized beyond health sectors. So there's been a lot of key stakeholders from other sectors and universities and research arena as well. And the WHO chief scientist, Jeremy Farrar, who is a well-known public scientist globally, his main role, and that's why he joined WHO last year, is really to support that process, how to build back trust in science, because we are at a turning point. Every country is at a turning point, not only to address all these global challenges, but really to address this trust, because what we see geopolitically, it really has implication on politics. That's visible in various elections all over in the globe recently, as you see. And it's not only that COVID brought up the trust and mistrust in science, but also this misinformation and how to address that. So this is really one of the main working stream as well, that no matter which strategic priority areas you address, we are working on that together. And we also done a lot of capacity building related to that, like infodemic management, that's what we call it. So even here in the Czech Republic, we had even the strategic communication team from various ministries join that. So there is already practical tools that countries can use and utilize, so we also bring it. But of course, we also have to learn as scientists, honestly, and as public health experts and as, government experts, to speak simple and easy language to explain what is the implication. And I think we definitely have a role to communicate better with the public on that.
Yeah, and I hope we did our best today to do that a little bit, to explain in very straightforward terms what the WHO is doing in the Czech Republic and globally as well. There's one more question that I ask every guest, which is if you had all the power in the world, if you could institute one change in the Czech health system, regardless of the financial investment or feasibility needed, what would it be?
I think I already addressed during the interview in a way, because of course there are many streams, public health, primary health care, but everything comes to data. And how it is translated into policies and how digitalization is moving ahead. So my major point would be to make it happen as quick as possible, because we always say what gets measured gets done. And I think it's very important there are political commitment to move things ahead. And no matter how, changes may come on government political level, but better data and knowledge management to be in place with cross digitalized system would really help the country a lot.
Mm-hmm. Okay, well, that's an ambitious wish, and I think it would make all of our lives a little easier and healthier if that were the case. And with that, thank you so much for the interview. Good luck with everything you do at the WHO, and we'll keep up the good work.
Thank you so much for the invitation as well.
Díky za pozornost. Pokud se chcete dozvědět více o naší iniciativě, znovu opakuji, že se můžete podívat na naše stránky efektivní zdravotnictví.cz. Díky za pozornost.